Hello. Trigger finger is one of the commonest orthopedic problem we have to encounter in our day-to-day OPD basis practice, and this is most commonly due to the thickening of A1 pulley. Why? What does it mean by A1 pulley? Means if we see the anatomy of our finger, in the flexor aspect there is a flexor tendon, and this flexor tendon has two slip, one flexor deuterorum long profundus and superficialis, and all of them are attached with the corresponding phalanx, and it has been encircled by some fibrous structure with the bone. These are called pulley, and now during the movement, and it helps for different mechanism of action of in different joint. And there is two types of pulley here. One is circular pulley, one is the cross pulley or cruciate pulley. Okay, now this circular pulley has 4 in number: 1, 2, 3 and 4. Now this circular pulley, number A1 pulley is most important, which is present just proximal to the metacarpophalangeal joint. Okay, and this pulley has a tendency to get hypertrophied, along with the aseptic inflammation of the synovial tendon sheath over this proximal aspect of the flexor tendon. As it become inflamed, and it cannot go easily through this pulley, that can cause intersusception type blocking of or it can cause the blocking of the gliding of this tendon. As a result, the extension and flexion of this finger will be hampered. Now, as per our common sense, we used to get this present in late phase, and maximum cases used to get treated by normal NSAID, and sometimes we used to see that we can use depometrol or local steroid along with local anesthetic agent. We can inject over that pulley, which can be palpated clinically. And sometimes in early phase this will help, but it again recur, and after that we have to go for open reduction or open release of this tendon or pulley of over the tendon. So it needs a team which have to need a admitted patient for giving brachial anesthesia or general anesthesia to perform this surgery, because without tourniquet you cannot do this surgery properly. For the beginners, it is very difficult to manage or counsel a patient for this release to get admitted and do this surgery. And after that surgery, there is you have to give stitches, and for this release, if you give stitch and you have, then patient have to again attend to your OPD for stitch removal and all that. So for only one problem you have to call the patient for multiple times. Okay, and not only that, this trigger finger is associated with some problem like diabetes mellitus, hypothyroidism, and pregnancy, and sometimes it can be idiopathic. And in that case, what happened, this finger get locked, and it will suddenly trigger off when this is released. But And we can get it in various stages, like stage 1 in mild capitation in a non triggering digit, it will only be painful. After that we can get gate 2 where there is uneven movement of the digit, they are allowing the pain, and get after that grade getting will increase, the locking mechanism will increase. In case of gate 4 it will locked permanently, and gate 3 we can see that there is patient cannot extend his finger actively, you have to release the finger by passive correction. So it is grade 3. Now don't do not need to mark up this grading, I just want to show you the maximum patient came on grade 2 onwards. So there is a passive you have to do a passive release of this triggering, and sometimes it this patient used to get multiple treatment from multiple doctor. But what we can do for this patient, we can do a percutaneous release by local anesthesia only. So maximum 1 to 2 drops of blood will comes out, and patient will get his result quickly. For this this technique you have to know some special anatomy. Suppose most common finger affected for trigger is ring finger, and for is fifth, fourth and third finger, the distal crease, along the distal crease we can get the A1 pulley. Okay, here is the location of the A1 pulley. And for the index finger, the proximal crease is the with the midline will the landmark of this trigger ring effect or nodule. If we get trigger finger in the thumb, it will correspond in the proximal creases. Now with this anatomical knowledge, if we can go with this type of patient, then we can do what that we will give a local anesthesia over this triggering point, and we can perform a needle based surgery. I have taken 18 gauge BT set needle, and I hold it with a 5 ml disposable syringe. After that, after giving a local anesthesia over this that nodule, after 1 to 2 minutes of rest, I put this needle as a knife, small knife, and I just do the release of that tendon by a vertical direction to and fro. That will digitally palpate. I will allow the patient to extend his or her thumb, and that can cause the cutting of that A1 pulley. And as you can see, after this small operation, the locking is goes up, and patient can easily extend or flex the finger. So maximum 1 to 2 drops of blood will come, and you have to press that bleeding point with a sterile gauze for 5 minutes, otherwise it can cause hematoma. Now if you fail, or if you cannot perform it in first time, you have to get another chance, or you will get another chance easily. But if you have opened it, this can cause multiple comorbidity, this can cause a anesthesia risk, and it can extend, or it can increase the treatment cost. So only giving a small anesthesia, and we can perform a big surgery by a needle only. So I think this technique will help our resident for doing this case in as a OPD basis practice. Okay. Now you have to know there is a part is called congenital trigger finger, and it most commonly affected is child, and this toddler cannot tell you anything. You have to just observe that there is a flexion contraction of the thumb. It may be bilateral, it may be unilateral, and you can palpate a nodule over the base of the thumb in the flexor aspect. So if it is a dominant hand and it is bilateral, then you have to go for open surgery, because you cannot do this Parkinson's procedure and in a small child, because he cannot cooperate. So I think I can give a small introduction over the trigger finger. Hopefully it will help in your practice.